Parkinson's disease affects many systems of the body. Regarding the cardiovascular system, studies have shown that patients with Parkinson's disease experience arterial stiffening. This can cause a continuous increase in systolic blood pressure, which may be indicated by Mrs. Kite's blood pressure of 158/110. Additionally, other organs that rely on blood circulation may be damaged, including the kidneys and brain. Loss of balance is also common in Parkinson's disease patients, associated with bradykinesia and tremor. Patients may experience episodes referred to as freezing. When this occurs, patients are unable to move and describe it as being stuck to the ground. This has been noted to be caused by loss of non-adrenergic neurons located in the frontal lobe. While an increase in medication may reduce the occurrence of these episodes, it may increase the occurrence of tremors, which in return have a negative effect on balance and gait. Small shuffling steps that are slow begin to occur throughout the disease process and worsen. This is due to muscle degeneration as well as cognitive deficits. Mrs. Kite's medications may be to blame for her increased tremors, causing difficulties with fine motor function, such as buttoning her blouse, as well as the feeling of being unbalanced. Not a lot has been discovered in the respiratory system. One common change that has been noted is severe inspiratory muscle weakness. This can be caused by tremors of the diaphragm. This is mainly due to the increase in muscle and chest wall rigidity. Degeneration of the substance nigra and the following loss of dopaminergic neurons also cause changes in ventilation. These effects change their breathing pattern as well as speech patterns, causing more effort to be needed and more fatigue during and after speaking. While signs and symptoms are treated by anti-Parkinson medications, throughout treatment as medications may wear off, these symptoms such as shortness of breath may return. Additionally, the patient complained of trouble sleeping, which is a common problem for patients with Parkinson's disease. Sleep apnea, insomnia, and consequent sleepiness during the day have also been reported. These are caused by restrictive or obstructive patterns associated with Parkinson's disease. Due to the previously discussed stiffening of the arteries in patients with Parkinson's disease, the alteration of blood flow is associated with deficits in attention, language, function, and memory. The decreased circulation has been noted to cause increased white matter in the brain, silent cerebral ischemia, and an overall lower brain volume. The effects can cause a functional decline as seen throughout the disease process, which may account for this patient's confusion that is likely to worsen. Although motor signs and symptoms are usually focused on the most, other systems are affected by Parkinson's disease. The autonomic nervous system is impaired, exerting effects on the gastrointestinal system. Malnutrition, pulmonary aspiration, and intestinal obstruction or perforation have been reported. Constipation is a common initial problem affecting 50 to 80% of patients. It is caused by paradoxical contraction of voluntary sphincters during defecation. Decreased gastrointestinal motility associated with neuronal loss plays a part in this. Drooling is seen in patients as well due to reduced motor control of the tongue, impaired medullary center function, and increase of saliva production. Also, nocturia and urinary incontinence are also expected findings that occur along with the disease process due to muscle degeneration of the detrusor and degeneration of the central nervous system. Finally, side effects associated with the medication carbidopa-levodopa include nausea, vomiting, diarrhea, and uncontrolled muscle movements, which may occur when the patient begins to take this medication.